major provision in the Affordable Health Care Law is being put on hold. The Obama administration announced that it is implementing a one-year delay before implementing the mandate requiring larger businesses to offer health insurance. Some employers complained that the provisions and regulations are just too complicated. While this is a major development, the impact is not as widespread as you might think. Our Megan Norman explains.
Judy, this provision affects businesses that employ more than 50 people. Tonight, I spoke with the president of the South Carolina Small Business Chamber of Commerce. He says this delay is good for a very small percentage of businesses.
While this might be shocking news, in reality, it's not going to have much of an effect at all on the implementation of the Affordable Care Act.
Frank Knapp has been following this issue closely. The provision affects only those businesses that have more than 50 full-time employees. So Knapp says this one-year delay does not have a big impact.
Most businesses, in fact 96% of the businesses in this state and in this country, have less than 50 employees. So they were under no mandate to offer health insurance anyway. So today's message does not impact them.
By 2015, those medium to large businesses would be required to offer health insurance. The delay gives businesses more time to figure out how to comply with the law and allows the federal government to simplify the reporting process. Businesses that do not comply will be penalized, but not until 2015.
This is going to give everybody more time to understand it. The Affordable Care Act will roll out in January of next year. It will have a full year of implementation. Everybody will understand what the rules are going into 2015, and it should be a more smoother transition.
Knapp says some business owners have been trying to skirt the law by trimming its staff or cutting hours, even reducing employees to part-time status to avoid having to provide health insurance. Again, the Affordable Care Act takes effect in January of next year, but in October you can begin signing up for health care coverage. In the studio, Megan Norman, WIS.